Do members have anything that they wish to declare?
It's a good start. It's the suicide prevention annual update, item 8. I'm a Bridge Watch volunteer.
Thank you.
Noted. Moving on to agenda item 3, minutes, to agree the public minutes and non-public summary of the previous meeting held on the 11th of July. No comments were received in advance of this meeting. Do members have any comments?
Done. Thank you. Chris, we just wanted to come to you on matters arising, please.
Yeah, so there was a very helpful discussion about the first aid interventions at the last Health and Wellbeing Board and an action for us to take this forward. I can't see whether there's a colleague from Health Watch in the room, but we have been having discussions with Health Watch, and there is a meeting that's scheduled to take place. I think it might be in October now, in relation to working out what more we do in relation to increasing access and uptake of first aid interventions in the city.
Rachel, welcome. I think you're online from Health Watch. Did you want to add anything to that?
Yes, I believe we've got a meeting in a couple of weeks. It's in the diary, yeah.
Fabulous. Thank you. Okay.
Just to confirm that members are happy to approve these minutes as a correct record? Yep. Thank you. Moving on to agenda item 4, Better Care Fund 2024 to 25, end of year return, and 2025 to 26, quarter 1 progress report. This item is for decision on pages 15 to 38.
Super. I'm going to hand to Ellie for this, but my understanding is that this is really a statutory approval of both of the reports, that we are happy that they are solid. So Ellie, over to you.
Thank you. Yes, as the Chair said, these 2 reports are for approval. Health and Wellbeing Boards have to approve these reports. I won't go into detail. All the information's in the reports. And just to say that there's some publication of potential reforms to the Better Care Fund, which will tie the funding streams in more directly with the new plans around the neighbourhood health care service. So watch this space for potential changes to Better Care Fund, but for now this is just for members to improve these 2 reports.
Super, thank you, Ellie. So has anybody got any questions that would prevent us from approving both of these reports? Fabulous. All right, Ellie, thank you so much. That's great.
Chair. Moving on to agenda item 5, Pharmaceutical Needs Assessment 2025 to 2028 final report. This item is for decision on pages 39 to 166.
Lovely. Thank you so much. Now, Chris, I think we were going to introduce at this point a colleague from Healthy Dialogues, and I just can't see on the screen whether we have been joined. Can you steer me on that?
Emmanuel, do we have?
No.
It may be that we're slightly ahead of time. I can, by all means, start this item, and then
let's do that.
Even if they don't join, I'm more than happy to try and answer any questions.
Fabulous. Chris, if you would steer us about what you need from us in this item, please.
Thank you.
Thank you.
So thanks very much for the time on this item. So we are required, as part of the legislation that set up the Health and Wellbeing Board, to undertake a needs assessment around community pharmacy. We don't actually do the commissioning. This is commissioned by the NHS, and I think recently the commissioning responsibility for community pharmacy has come down to the Integrated Care Board, so this would be North East London. Community pharmacy is fairly, well, it's heavily regulated provision of market entry and market review. Every time there's any change to the provision in community pharmacy, Health and Wellbeing Boards are asked to input into that. In the main, to give a sort of an overall summary, the City of London is very well served by community pharmacies. We have 9 community pharmacies, and there are a very large number within less than a mile that anybody can choose to use. Community pharmacies provide a range of services which the NHS provides, so all of your prescription services, some of the enhanced services that we commission locally, like some of the sexual health services, but also there are national services that are provided through community pharmacy. So what the needs assessment essentially does, the health and wellbeing boards are asked to undertake that. Public health is requested to lead on that, and we commissioned a specialist company who actually go out and review the community pharmacy provision, undertake a lot of consultation and a lot of analysis, and then essentially this comes back to yourselves to confirm that you're content for this to be published as the City of London pharmaceutical needs assessment. And then, as I said, our NHS colleagues then use this for the next from 2025 to 2028 to consider whether there are any changes that need to take place in provision, and if there are any market entry, then to look at whether there is need for market entry or a need for different types of provision. So in summary, we do believe that there is very good and continued good access for residents and for city workers to community pharmacies. And if people are in the health wellbeing board is in agreement, then this would be published and this would become our needs assessment. Thank you.
Super. Many thanks, Chris. So just to be really clear, my understanding of this is that we're being asked two things. One is to approve the robustness of this report for publication at the beginning, well, before the beginning of October. The second is just to, as I read through it, I noted that there's a line that says the Health and Wellbeing Board is content that pharmaceutical community pharmacy provision is more than sufficient now and over the course of the next 3 years. So we need to be clear that we are happy with that statement being put out in our name. I think those are the two questions that we've got to answer. Is it robust, and are we content with that statement? Would anyone like to comment or ask anything? Marianne.
Just ask one quick question on page 18 2.19, the tobacco needs assessment recommendation. It just headline denormalising smoking. Are we also including denormalising vaping in that context as well, or is it just tobacco? Because I think that's a huge health need within City and Hackney.
Chris, is that one for you?
It's a level of detail that I confess I couldn't immediately recall. We have had quite a lot of discussions, and I think we do have a position statement on vaping, but in relation to the very specific question, I would actually need to go back and consider it. But I think, Marianne, you're absolutely right. We don't promote vaping. Vaping is very specifically in relation to smoking as a smoking cessation aid. And I think there are regulatory changes, but in relation to the very specific point of what's in the tobacco needs assessment, I would need to review it and come back and can answer it at either outside of this meeting or as a matter arising.
I personally would like to see denormalising vaping included in there as well, because I think that's the next big health issue that's going to hit the country.
So. Sorry, go ahead, Judith.
Thank you. Yeah, just to confirm what Chris says, this is the vaping. We only recommend vaping in terms of smoking cessation, not in terms of casual use, which is, as you say, an increasing problem.
So I think there's potentially two slightly separate issues there, both of which are to take away. One, Chris, which is what is the statement in relation to the pharmaceutical needs assessment in relation to vaping? And the second is the point which we've covered at other meetings around just really clarifying what is the city's position around vaping. There's one thing which is about what's in here, and there's another which is a slightly more general point.
But if I may have misunderstood, and apologies, but I think Councillor Fredericks is referencing what's in the tobacco needs assessment. So this needs assessment references that, and as an action to confirm what we actually say about vaping, but I don't think it would be necessarily in the pharmaceutical needs assessment to make any comments about vaping. It would be in relation to what the tobacco needs assessment and the statement that we've agreed at the Health and Wellbeing Board. Community pharmacies do have a really important role to play, both in tobacco cessation and in terms of vaping. They do provide vapes as part of the NHS stop smoking service provision. but I don't think it would be necessarily for the pharmaceutical needs assessment to make statements in relation to the health harms of vaping. That would be for the tobacco needs assessment, which it does, I think, if I'm looking at it correctly, does reference, but just wanted to be clear.
Thank you, Chris. Gosh, that's complicated. Sorry, I understand. Fine. So there is no action in relation to the pharmaceutical needs assessment. There is simply a clarification about the position statement in the tobacco needs assessment. Thank you. Great. Any other questions in relation to approval of the pharmaceutical needs assessment?
Judith. Just to say, I think this is a thorough, comprehensive report. We're required to do it. I think it meets our. We can see that the pharmaceutical provision meets our requirements. Thank you.
Super. Sorry. Go ahead, Emmanuel.
Just to say that Joel Malimba has joined the call now and is online.
Ah, fabulous. Welcome. Would you like to do just a brief introduction?
Hello, everyone. I'm Joel Malimba. I'm of Healthy Dialogues. We supported in the compilation of the pharmaceutical needs assessment.
Thank you so much. I think we're nearing the end of this conversation, but I did just have one question, which was about the equality impact assessment as part of this report. There was a clear statement in the equality impact assessment that you thought there was no differential access in relation to groups with protected characteristics. But I also noted that the 69 people who you spoke with or who you got information from via the survey were vast majority white. And I just wanted to double check that you feel confident about the robustness of that assessment, given the profile of the people that you surveyed.
Yeah, so it is a small sample size, but it's for City of London, it's fairly large for this kind of survey. So what the equality impact assessment can say is, looking at the sample size that we captured, have we noticed any differences? Yes, I can see that there was a skew in the sample, but that's just because those are the people who the demographic is on a general response to surveys, but we did not find any differences looking at the various characteristics between the population groups.
So just to make sure I've understood that the sample size, even though it looks small, is not small necessarily in relation to the size of the population in the City of London, and you're confident in those findings.
That's correct.
Thank you so much. Marianne.
Can I just ask one question about the pharmacy? There's a diagram on page 74. I know we have lost the number of pharmacies due to redevelopment. The number of booths have been lost due to redevelopment. And if you look at that map, it does sort of suggest that the west of the city doesn't have any pharmacies. You have some on the fringe. We used to have an overload of pharmacies within the City of London. How many can we afford to lose without actually impacting too much on the population's health, given that they are now providing consultation services and other services, not just dispensing? And are we monitoring that? I know we have to do a report every time one wants to be removed, but are we monitoring it? Are we encouraging new units to go over to chemists, and independent chemists as well would be nice?
So, Marianne, can I just check that I've understood the questions? It's not a question about the robustness of the provision that we've got now, but it is noting a risk that if any were to be removed in future, what's the implication?
Apologies, your microphone.
Oh,
Apologies.
sorry.
Microphone.
There's nothing on the west side of that map. They tend to be centre and more in the east, but there seems to be nothing on the west or the middle.
Sorry, just to get really clear, currently in this report, there's no suggestion that the West is under-provided as things stand. Your question is, what risk is there for the future, if any?
And if we continue to lose with redevelopment chemists on the ground floor, do we have a plan to encourage new provision in new units which are going back up.
Brilliant. Thanks, Marianne. Chris.
So if you do look at page 74, clearly the orange is within the City of London, and I think even if there was further reduction in number, it's difficult to make this assessment now, but even if there was a significant reduction in number compared to almost any other local authority, the city would still be very well served. And the green pharmacies, because this is obviously an NHS service that's commissioned at a level, at the ICB level, so the ones in the west would actually be from a different ICB area, but we are always consulted of any changes, so that they write to Reese usually forwards it to myself. In previous years, the chair has delegated this to say, by all means, make any observations, but you can see that there are very large numbers of community pharmacies surrounding the city, and there continue to be a large number within the city. Marianne, you're obviously quite right that there's slightly less within the city in the west, but the assessment would not change as to that there is continue to be good access to to community pharmacies. And again, I think where we're very well placed in the city, this community pharmacy needs assessment for an area that's a rural area, for example, they are looking at the distance and time to travel to community pharmacies. And obviously in the city, the travel for any of those is still going to be relatively good compared to the standard that would be expected from NHS before you're saying that you would need to encourage further market entry.
Thank you, Chris. So I think I'm hearing two things there. One is that you think the risk is low, given that actually relatively the level of provision is high, but equally that any decisions that were made around that and the withdrawal of provision would come back.
They come back, I think, and we are given an opportunity to comment.
Yeah.
I mean, frankly, and those comments are, we would be what the need assessment is showing. And there is an annual update that we do to see whether any changes have happened. So, but it is unlikely, I think, that even with a larger number of reductions, that we would be coming to the conclusion that we don't have good coverage, but we are given that opportunity. And I think if there was, total loss of all of the community pharmacies in the City of London, we'd certainly be making robust representation, bringing it back to the board. But at the moment, if you're looking at, I think it's 9 within the city, and I think it's something like 58. I can't remember the number. It's numbers that, there's a significant number within less than a mile. And as I said, if you compare that to any other local authorities' access, it's going to be, we're well served.
Thank you very much, Chris. That's clear. Any other questions or comments? Fabulous. Okay, on that basis, I think we've heard two things. One is that we're content, Joel, with many thanks to you and colleagues, that the assessment itself is robust. And secondly, that we're content with the conclusion that provision is good both now and in the future. So many thanks.
Moving on to agenda item 6, update on City and Hackney Healthy Weight Action Plan and Public Health Obesity Contracts. This item is for decision on pages 167 to 178.
Now, can I check in, because I think we are meant to be coming to Jane.
Not online yet. No, they don't seem to be online yet. So let me just drop them. I'll instant message Jane to see.
Should we do that, and should we swap an agenda item around?
Yes, we move on to agenda item 7.
Great.
Agenda item 7, Health Watch City of London Progress Report. This item is for information on pages 179 to 214, and Rachel is online.
Super. Rachel, many thanks for being with us this morning. I think our job is to hear from you and your headlines and make sure that we have understood it. So please, over to you.
Okay, thank you very much, Chair. Okay, just to do a whistle-stop tour of the report. We had our public board meeting with Mary Elford, Chair of Homerton, last couple of weeks ago, and she had a couple of takeaways to come back to us on. One was on the discharge pathway for dementia patients, and one was talking about resident involvement in the place inspections at the Homerton. So we're waiting to hear back from her on that. We carried out a minor injuries unit visit to at St Bartholomew's Hospital, which is an underutilised service within the city. The report is almost finished, so we will be publishing that shortly, but that's part of a wider project that we're looking at emergency pathways and urgent care across the city. Adult Social Care Advisory Group, we held 3 events, one at the Guildhall, one at Portsoken and one at the Golden Lane Community Centre. The last one at the Golden Lane Community Centre was well attended. So we now have, we think, around 7 people signed up for the advisory board, which is great success. I'm going to be writing a report and sending that to Chris over the next week or so. Enter and view report for the Neiman practice. We just got a few final amendments to make to that, and then we'll be publishing that. You've all received our annual report from last year. I'm not going to go into it because everything that's highlighted we've already brought to the board already. So just to say that that's been published as a statutory requirement. Patient panels. The CPR is always a popular patient panel that we have. We had 5 residents last time, and we're looking to run another one. It'll be early in the new year. The ovarian womb cancer we had to postpone, but that's going to be next week now. So we're promoting that. And the diet and nutrition with the first contact dietitian at the Neiman practice is in early October. Just a few events that we've got coming up that I'd like to highlight to you. We've got our annual general meeting on the 17th of October, and we've got Dame Marie Gabriel, the chair of the ICB, coming along to talk to us about all the changes in the current landscape. We've got our meeting at St Bartholomew's Hospital. We've got Professor Charles Knight, the Chief Exec of St Bartholomew's Hospital, and David Curran, the Director of Nursing, coming along. They're going to be talking about their response to our enter and view report to their cardiology department, as well as giving us an overview of the hospital itself. And we've also got, we are in the process of organising our very delayed men's health event. I think it's going to be on November the 18th. We've got Dr. Chaw coming along, and we've also got Alison Hills, who's the Director of Palliative and Cancer Care at St Bartholomew's, coming along to talk about the cancers that specifically affect men. And just another note, we've got several of our trustees and board members who are going to be joining the place assessments that are coming up at Barts, Whips and the Royal London. I think that's it.
Fantastic, Rachel. Thank you so much. And I'm guessing that part of the ask of the board is you've got all sorts of important things coming up, and it's a bit of our job to drum up interest and people coming along.
Yes, please. That'd be great.
Super. Thank you. Any
Thank
questions, Dawn?
Thank you, Rachel. My only question would be along those lines of how you do communicate to residents. I know on Golden Lane Estate we received a leaflet dropped through our door regarding the 11th of September event. I read somewhere that you had sort of like low numbers for the Portsoken, was it?
Yes, we did.
Yeah. So I just wondered how you do actually communicate your events out generally. Thank you. Thanks.
Okay,
Dawn.
well, we try and do a leaflet drop whenever we can, but obviously that's quite an expensive way to advertise our events. We do have a monthly newsletter that goes out. We put our events on Barbican Talk and the Golden Lane Estate websites, and all our events are advertised via the city comms, so the city resident emails, and the Barbican has its own dedicated bulletin as well, so it goes in there.
Dawn, do you want to come back?
just to say that that is far reaching. So yeah, appreciate that. Thank you.
Okay, super. Thank you. Marianne.
Thank you. My question was very similar. I know I've signed up to your newsletter, and a lot of this is done digitally. I just wondered whether or not Healthwatch could be invited to the city residents meetings when we have them. We usually have tables. I've never seen you invited, so I think it would be really good, bearing in mind more residents live outside the main city estates than in them now. And it's very difficult to reach those residents when they're pocketed and scattered across the city. But perhaps one way would be to attend the city residents meeting. So perhaps that could be something that could be fed back. Thank you.
Marianne, by city res, do you mean the question time?
Yeah. They have tables and they have leaflets.
Yeah.
You used to, when we had it at the Great Hall, we used to be there in attendance, but I don't think they've been invited. It would be helpful to reach the residents who don't live on the Mansell Street, Petticoat Lane and Golden Lane and the Barbican. It would be really helpful. Once you've got people's emails, it's easy for you to get your information across, but it's that initial contact that's important.
Thank you.
Yeah, we were there. We weren't at the last one, but the previous one we were in the crypt underneath with everybody else. So we have been to them, but we haven't been to all of them. But it's
Thank you, Rachel.
Thank you.
Judith.
Yeah, thank you, Rachel. And we'll make the link with the City Question Time colleagues so that Healthwatch is invited as a matter of course. I'm really pleased on the Adult Social Care Advisory Group, Rachel. It's great that we've got more attendance and that group then can sustain the linking back to Portsoken and the other areas, particularly those areas of greater deprivation in the city, be a really important part of the work of this group. So thank you for taking that forward.
Okay. Rachel, I did just have one question on that. I did note at various points in the report the desire for a greater emphasis around engaging in Portsoken. Is there anything that you need from this board in order to make that possible?
Not at the moment. We do have. We are working with the match programme from the Population Health Hub to look at health literacy in that area, and we're also looking to possibly employ somebody on a 1 day a week basis to solely focus on engagement with the Portsoken area and the residents there. So I think next time we come to the board, we can give you an update on that. But I think at the moment
that would be really helpful.
Thank you.
Super. Thanks, Rachel.
Okay.
Any other questions or thoughts? In that case, many thanks for all of your work, Rachel. It was really heartening to read. Thank you.
Moving back to agenda item 6, update on City and Hackney Healthy Weight Action Plan and then public health obesity contracts. This item is for decision on pages 167 to 178.
Fabulous. Welcome, Jane. Sorry, we had got a bit, well, welcome, Jane and Donna. Sorry, we'd got a bit ahead of ourselves racing through our agenda. We're delighted that you're with us. Our understanding is that what you need from us for decision under this item is approval of the direction of travel of this work, moving much more upstream around preventing unhealthy weight. And second, you want some specific comments from us around the proposed City of London actions and anything else that we could contribute to that. Is that right? There's nods, that's good. In which case, if that's our job, then over to you, please, to just summarise where you're up to. Thank you.
I'm going to let Donna talk through this because this is her paper and she's been leading the work, but it's just a reminder that we did bring an initial paper to the board the end of last year, and we've been doing quite a lot of work since then. So this is really more specifically in terms of the whole system delivery plan will be finalised quite soon and we'll share that with you. But in the appendix, to keep the paper shorter, we cheated. There are just some sort of suggestions and prompts for the board in terms of what we can be doing specifically in the city. But you're right, Chair, it's that we do really want some endorsement of the direction of travel. And it's just to remind people, this is a very complex problem. It does require a very broad response. There's only so much we can do locally, but as part of the local, national, international response, we do have some levers and some powers locally that we can use. So that's what the paper is. And I just wanted to flag before I hand over, we have provided a very brief update on the latest obesity drugs. Now, it's a very complex picture. We are not commissioning them, but we have spoken to ICB colleagues and they'd be happy to provide a more detailed briefing if that would be helpful. But we're not going to be able to answer detailed questions on that today because we don't have the information.
Thank you, that's really clear. So an acknowledgement that that's part of the picture, but it's not a part that is directly within our control. Thank you. And just noting your other point, which is City of London actions in the appendix. This is almost like hints towards a delivery plan, and there'll be a more detailed delivery plan to follow. Thank you. Okay, fabulous. Donna.
Thanks all. My name is Donna Doherty-Kelly. I'm a Principal Public Health Specialist and I work in City and Hackney's Public Health team. So nice to see you all. And thanks to Jane for the intro as well. I'm not going to cover anything Jane's just talked about, and you've sort of heard what the recommendations from the report are. And Jane's also said that we came to this board at the end of last year to talk through the recommendations that were coming out of the Healthy Weight JSNA and our whole system review, and that's been used to inform this Healthy Weight delivery plan. And two of the pieces of work I'm going to briefly update you on are part of that plan. So the first one's in the paper. It's around it's what we're calling workstream 1, and it's around co-designing a new approach to healthy weight support. So we've already started this piece of work. And it's a system effort, so we're really hoping to engage with residents, those working with residents and partners across the system to think about the challenges and the barriers that we heard from residents and those working with residents while we were doing the Joint Strategic Needs Assessment engagement. So we do know quite a lot already about what the local barriers are, and this co-design is to take us to the next step, understanding what levers we have, as Jane said, locally, and what solutions we can develop together that are viable and feasible and sustainable for us to bring forward. So that process has started, and what that looks like is a series of co-design events. So we've got a full day event, and then we've got a series of sort of smaller engagement events as well. And hoping to work with children, young people, parents, families and adults as well as part of that, and obviously anyone working with those residents as well. So we've got some scheduled already. We're working with our community health champions. We've got 17 or 18 voluntary sector organisations interested to work with us on this, and we're also sort of exploring opportunities outside of community health champions so that it's as inclusive as possible. And why we're doing it, what we're hoping to get out of it, the output of the co-design activity will hopefully include proposals for one or more viable interventions for us to take forward within public health. And there might also be solutions that come out of that process that are wider system actions that we will be having discussions with outside of the public health team as well. So we're hoping to get to a point by the end of this calendar year where we have that list of proposed solutions, and then we're going to go through a prioritisation process with, again, residents, voluntary sector and wider partners to help us sort of hone down on that and think about what is practical and what's going to be effective and what's going to have the most impact as well. So that's workstream 1, and then the second one is linked. But there's a separate piece of work going on around healthy weight capacity building, and this piece of work is recognising that the scale of obesity is very large. We can't provide one-to-one interventions for everybody, but we really want to work really closely with settings to strengthen their capability and confidence to be able to have these conversations about weight, healthy eating, physical activity behaviours as well, and really have information to hand about what's available locally that will help people and motivate them to make changes. So we again are starting to scope out that piece of work in partnership with the wider system as well. So it's really about developing and piloting an approach to that capacity building. We're hoping to, as I said, improve confidence and competence among staff and volunteers as well, increase awareness, and we also want to develop a plan around addressing weight stigmas and have that at the heart of this work as well. So it's a 2-year pilot starting next year, and we won't be able to do everything, obviously. So we are going to start thinking about some settings that we can work closely with to pilot this approach. So some examples are primary care, maternity services, community food shops and hubs, cultural or faith organisations as well. So that's to be confirmed, but that just gives you a flavour of what we're thinking. And then moving on to the sort of wider healthy weight delivery plan, which those 2 work streams sit under. As Jane said, it's not completely finalised, although work has already started, but we will share that with you in the upcoming weeks. But there won't be any surprises. It's sort of very much linked to the themes in this paper and the actions in the appendix as well. So they're around driving change through collaboration and partnership across the system, using evidence and data more to drive action and to drive improvement, making sure we're designing and cultivating our environments to support physical activity and improve the food environment, build, as I said, our workforce capacity and skills, and then make sure we're prioritising equitable and inclusive approaches to promoting healthy weight. Oh, and finally, addressing weight stigma, as I said. So as Jane said, the table's in Appendix 3, and if you look at that table, you'll see there's quite a lot of opportunities under, I think it might be Pen 2 in yours by mistake, but it's actually the 3rd theme around designing and cultivating environments to support physical activity and healthy diets. There's so many opportunities there across City and Hackney to think about action to address that. And then there's obviously proposed actions under each of the themes. And a lot of that work, as I said, is starting to be picked up now. For an example, theme 4 I've just talked about, that's in terms of building the workforce skills and capacity. So I'm happy to talk through any of those, and Jane sort of already provided a brief update on the medication, but that's sort of a whistle-stop tour of what's going on. There's a lot going on, and then just to say, yeah, just to remind you, yeah, we want you to note the progress on the plan and comment on those proposed opportunities and how the board and the membership organisations might be able to support some of those actions. I'll stop there. Jane, maybe there might be more you want to add as well, I'm not sure.
Many thanks, Donna. That was a really helpful whistle-stop tour, as you put it. I think so. You're asking us 3 things. One is overall direction of travel of this work, and then secondly, it's to comment specifically on the opportunities within the City of London and what the board and others might do to contribute to it. Just before I open it up, I just wanted to ask one clarifying question, which is in your work stream 1 and work stream 2, those I think are, am I right in saying that those are across City and Hackney? And if I am, then I just wonder if you might be able to say in both of those what the sort of how the city focus will be represented, both in the co-design and in identifying the partners for capability building.
Yeah, that is right. They're both City and Hackney pieces of work. Within the system, or within the first work stream, we've actually already started engagement in City of London. So our first session was at the Aldgate School with children, which was a really interesting session. The outputs were sort of around, it was quite young children, but the outputs were around interesting insights around high calorie food that these children were eating for breakfast, in particular sort of breakfast on the go, but there was a lot of discussion about food that is high in sugar and high in calories as well. So that's something we'll be exploring. There was also an output from that session is for us to sort of engage with City of London holiday activity fund providers as well, to think about if there's any collaboration there we could do around that setting and making sure that where possible and where food supply is available, we can think about healthier options there too. So yeah, it was a really brilliant session, and that was sort of hosted by early year, so the connection was with City of London's early year team. And then we're just exploring the community health champions in terms of, are any of those based in the city as well? What's the opportunities there? We're working with City of London libraries as well to explore parent workshops. And we did actually engage with quite a few City of London residents via the JSNA process, so we can open the opportunity out to them as well. And then finally, we have got some stakeholder specific events where we'll be inviting City of London stakeholders to come along and join that conversation with Hackney colleagues as well. In terms of work stream 2, that is very much a City and Hackney work stream as well. So for example, if we did decide to work in primary care and focus on them as one of the settings, then that would be across City and Hackney. So we'll be, I guess it depends on what system partners think we should focus on for the next 2 years, and then making sure there's equity across City and Hackney in terms of the support for the settings as well. So yeah, very much an integrated approach across both areas.
Thank you, Donna. That was really helpful. So any opening up to any questions or comments in relation to the overall direction of travel and the specific opportunities in the city? Marianne.
Thank you. I think the description of healthy eating for a lot of people is highly confusing.
Yeah.
Because you know, we're told don't eat fats, and then it's the sugar that's the problem, and it's the mono fats that's the problem. And you go into the supermarket and everyone has different size, weights, and you're trying to work out what sugar content, this, that, and the other. It's incredibly confusing for people.
Yeah.
And then when we lump healthy, affordable eating, again, that's incredibly difficult for people to do. And we're then being bombarded with adverts for food which are completely unhealthy for us. It's subliminal advertising, it's everywhere. And I think there was a doctor who's a well-known doctor who does health programs on the BBC. He said, if anyone is obese, it's really not your problem. You are being bombarded with adverts and encouraged, regardless of what the government and what we are doing, to eat badly and poorly. So anything we can do to really get a very clear, understandable message regarding what foods are healthy, the things to really avoid, and just greater education, especially at a very young age, because we're seeing that, you know, children aged 4 and 5 are already over the healthy weight limit. Whatever we can do to get that clear message across would be fantastic. And the other issue that I don't see here is the effect that hormones have on weight, especially on women when they hit menopause. And that can be even more upsetting for somebody who has always eaten healthily and maintained the weight, and then suddenly hit menopause and everything just goes haywire. And it doesn't matter what you do, and eating healthily, you still can't get to grips with keeping your weight under control. And then it brings things like depression and everything else in with it. So what are we doing in terms of that key driver of weight gain to help women come to terms with that? And I understand it doesn't last forever. Once your hormones balance out, it gets better. But when you've gone from a period of being normal weight all your life to suddenly being overweight, it can be quite devastating for women, on top of all the other things they're dealing with at the time when they're going through menopause. So do we have a separate stream for that, or is that something we include in our menopause work? And if so, should we be actually joining it up and bringing it together? Which I think comes back to greater education about the food, how our body processes food, the things
Marianne.
to really avoid, the things that are nice to have occasionally. And where we can get affordable food. I will say Tesco's is now stocking more meat than it used to, more healthier stuff, but it's still got a lot of takeaway microwave stuff, which we know is very good for our health.
Thank you. So fabulous. I'll just note the two sort of core questions that I took from that, and then I'll hand over to Dawn. I think there's one about your strand around healthy environments and what is it that we're doing around unpicking what healthy eating means and how we're supporting people around that. And the second is around where, if anywhere in this, are we supporting women going through the menopause. So I'll come back to you in a second, Donna, on those two. Dawn.
Thank you. I was shocked last night. I was on social media, as you do, but there was emphasis regarding buying a packed salad in a supermarket, and the content is containing things like rapeseed oil and stuff like that. So you think you're buying something healthy as a lunch, you know, on the go lunch, but actually it's actually damaging for your health somewhere along the line because it's got all these oils that are not good for you. That was new to me. The other thing I'd like to point out is I think it's great that we go into schools and talk to children, but actually it's the parents that we need to be focusing on, because they're the ones that are giving a child a croissant on the way to school, or not giving them anything to eat, let's be honest. Perhaps we should just focus more on sort of like healthy eating programs for parents. Thank you.
Many thanks, Dawn. Before I, Donna, come back to you, any other questions to sort of take in this pool? Fine, so we've got questions around healthy eating and clarifying what that is and what it looks like. I think that overlap between both Marianne and Dawn, that was really helpful. Questions around menopause and questions around what does it really take to support families? Is this more about supporting parents than about targeting children? Donna.
Thanks. Yeah, really interesting questions there. I think in terms of the first one, awareness and education is very much part of the plan, and sorry if that wasn't explicit in the paper, and it will definitely be something we're thinking about in terms of the capacity building work and communications more broadly as well. I do think it is very hard to eat a healthy diet in London, and you know, you do need to have information and education to hand to be able to make the right decisions, and I completely agree, we're just bombarded with unhealthy food as well, but I do think there are some key messages that we can shape that will help people think about what it is they're eating, and there are steps that you can take to sort of make your diet healthier. And then in terms of the environment, again, I think this is a key piece of work for us to think about in terms of building this behaviour in as early as possible, and where are children during the day? They're at school, so what is the school offer like, and how can we support healthy eating within schools and support parents obviously as well as part of that. And I agree with you in terms of educating parents and children on this, and we heard a lot about this when we talked to City of London parents about this as part of the JSNA. You know, they find it really hard to understand what the right food is, and that comes from weaning stage right up, as I think I said in the last Health and Wellbeing Board meeting. So I think there definitely is a piece of work for us to do there around parents. Education is one bit, but we know education isn't enough to change behaviour, so there's lots more that we need to do as well, and sort of think about what we do more broadly across the system. So it is one piece of the puzzle. And in terms of menopause, it's not something that explicitly came out of our insight, so thank you for raising that. We heard a lot about emotions for women of that age, but nobody explicitly talked about menopause from any of the work that I did, but it is a good point. I think one thing we have drawn from the JSNA and speaking to residents and stakeholders is that sometimes obviously life events trigger these types of things, and you could sort of talk about the menopause in that term, so we know when something big's going on in somebody's life, they might have had good habits before, but those sort of fall during that period. So yeah, it's not something we've explicitly thought about, but we can think about that when we're talking to settings and thinking about that capacity building work as well. Did I answer all of your questions? I hope so. Jane, I don't know if there's anything you wanted to add.
Yeah, go ahead, Jane. Thank you.
Yeah, there was just one thing on the parents. We do have the Henry service that we commission locally, and I think we will be looking at recommissioning that over the next few months. So we're definitely thinking about how we can improve the reach of that. But I think it does go beyond that, and that is it's been really front and centre, the need to work with parents as well as doing stuff with the schools. So, and the early years and the earlier, I think we talked about this last year actually, about that need for that really early intervention. But I think what we really need to take Donna's point there, we can talk to people, educate and whatever, but actually what we really need to be doing is making these environmental changes. So it's almost like healthier behaviour by stealth. And just a good example of that is the healthier catering commitment that the environmental health team in the city actually deliver, where it basically reformulates the food that is sold by a hot food takeaway. So we're also trying to not allow any more to open, but there are loads already out there. But actually what it does is it creates a healthier offer. And even though it might not, they'll still maybe sell chips, but the chips are fatter, so there's less fat on them. They may have, this isn't so much related to obesity, they may still have salt, but they just have one tiny hole in the salt shaker rather than lots of it. There's lots of things you can do that actually at a population level have quite a big impact. And then there's also, obviously, we can't do everything locally. There is a lot of, I don't know if people saw in the 10-year health plan, there was quite the whole section on obesity. And one of the things that the government is doing, they have introduced various advertising bans and things, but they are going to be introducing mandatory standards for healthy products sold by food retailers, and that will be used as a baseline against which there'll be targets in the future, so that at least there'll be some transparency in terms of the healthiness of the offer. So we hope that needs to happen as well. We can't control, you're right, you know, the sort of like the food industry, it's a really difficult battle. I mean, it's just what we were trying to do with tobacco all those years ago. But it is a bit more nuanced, and we do need to work with them. And there is a lot of work going on nationally around that, but we just need to make sure whatever we can do locally, we complement that.
Thank you so much. So I think you're hearing a real interest from the board in the delivery plan around two of the things that are already absolutely in there, which are around the healthy eating comms and support, and secondly around how do we best support parents and young people, and a supplementary question about where, if any, is there a place for a particular focus around the menopause in any of this. Could I just ask one broader question? I think we've got time just for 1 minute, which is, my goodness, there is so much in here. Of course there is. You've said a systemic approach is sort of everything. I wonder, it makes me wonder two things. Firstly, have you got the resources? What resources do you need to really drive this forward, and have you got them? And the second is, it might be a delivery plan point, but where do you think are the most important places to start? Because it would astonish me if you said you could do all of this all at once.
Yeah, very good observation. I think obviously within public health, we have pretty limited resources. It's me and Jane that are working on this plan, and it really does rely on system partners to sort of engage and think about how they drive the actions forward within their organisations as well. As us, we can help support that in public health, but we are not able to sort of drive the work forward ourselves, and it won't have an impact if it's just us. So there's there's an ask from system partners in terms of having a bit of time to sort of consider how this action plays out within their respective organisations. So limited resource, I would say we have, but we've done quite a lot of work on this already with limited resource. So I feel like we can still, if we're working as a system, we can still drive this work forward. In terms of the most important areas, I think they're all really important, and that's why they're in the plan. But I think the biggest opportunities are the environmental ones. Anything we can sort of embed in policy and process and practice as business as usual, I think, are the biggest opportunities. And you'll see there's a lot of them within that theme in the back of the appendix. I think if I was going to, if I was City of London, I was going to focus on something, that would be the first thing I'd look at in terms of, are there any opportunities within the work we're already doing to think about embedding health in these actions within our approach that we're already taking.
Thank you, Donna. Dawn.
Can I just make a point of around comms? I've said this before in another committee, but I think it's really good that I think we should be using more the council tax when we send out our council tax bills, because you reach every single resident in the city. If we could just, I don't know how much you can drum down people's throats about healthy eating, but I'm sure a fact sheet in that council tax drop wouldn't hurt, and literally you are ticking a massive box there and getting the information out. But I think we should be using the council tax leafleting as a much better tool to just reach everybody.
Thank you. We'll take that away to Chamberlain colleagues. There's usually quite a big ask on those council tax bills in terms of what people want to get out, but we'll certainly raise that. Thank you.
Fabulous. Thank you. So I think in terms of your overall 3 big asks, approval around the direction of travel, I think I'm hearing real enthusiasm for getting upstream around all of these things, and a particular interest in the delivery plan in relation to your environmental piece, which you've also said is a priority. You know, how is it that we support and communicate clearly with people around healthy eating and healthy diets? So I think you've got all of that. I think my only outstanding question is there anything in particular you want to ask of the board in support of this? And is there anything that the board wants to offer up in terms of other places we could be helping to pull all of this off? So I guess Donna and Jane first. Are there any specific asks from you? And sorry, I'll go to Jane and then Marianne, I'll come to you.
I think in the paper we set out that we're setting up governance around this. We're trying not to over govern it, but we do need some sort of strategic direction. And well, also importantly, we will be having a community partnership as well. So it's not just sort of like senior officers and members. But what I think an ask is that we would really like a commitment from each member of the board of something you could contribute to this, and we're hoping that there will be representation in some way on that strategic partnership from the board and board members. But I think it really is a bit over. These are the board areas. I'm thinking about things within your gift that you could, even if it's advocating or whatever it might be.
Yeah.
We would love that, to have just a set of commitments from the board that we can include in the plan, and then we can just come back and then we can try to help and support those being implemented, but we can then bring that back and update and think about how we can sort of strengthen that at a future meeting. But yeah, that really is something that would help.
Thank you, Jane. So that's a really clear ask and action for all of us, maybe before the next board to come back to you with suggestions of where we can contribute. Thank you, Marianne.
I was just going to ask the question, bearing in mind the implications that our weight has on a range of ailments that the NHS has to deal with. And a lot of those come back to us in different reports. It'd be really helpful for us, and again, to educate the impact that health has, the weight has on your diabetes, your blood pressure, complications in pregnancy and birth, and so that we can see all that stream and see the effect that it has, and we can then monitor the impacts on the weights work that you're doing on those outcomes as well. And I think people don't really realise when you're young that being overweight at a certain stage can have a real medical impact further down the line, and just losing weight and keeping that weight balanced will ensure that you're not going to have a number of ailments which will impact on the NHS bill and your ability to have an active life. So we do all these different reports, but I would like to understand, being overweight, getting pregnant, what's the likely outcome of having to have a caesarean section, and all of those impacts again on the baby. I'd like to see, and it's a huge piece of work, but somebody somewhere must have done this, because somebody at the NHS must have been monitoring this.
So Marianne, is that a request for the board to come to that, or for a sort of behind the scenes briefing on the impact of healthy weight across a whole range of other issues and areas?
It would be nice if it wasn't a public report, so the public can actually see, this is what happens at this end, but this could happen at that end if you don't address this end.
That sounds enormous. I'm gonna look to colleagues for steer on this.
I think that is enormous. You're right. It's a well-trod path. Why don't we invite our colleagues to come back in 6 months or so, and we'll have a bit of an update on the plan, but just answering that question as well in broad terms, but not in quite the same detail for city residents, but in national perspective.
Or perhaps you have people who come and do presentations, people who, for example, do diabetes and other areas, and they can talk about that and the impact on weight had on that condition.
So sorry, go ahead, Jane.
I just before we go into, there is loads of research that's been done on this, and the JSNA, the Joint Strategic Needs System, does cover this to a degree. So it might be worth having a look at that and seeing if there's anything additional that you might need. But you're right, the data for the city, we're not going to be able to do a lot of detailed analysis just for the city. But just one thing to say is, I don't know if this is what you meant, but it's impossible to link anything that we do to try and reduce obesity prevalence directly to some of those health outcomes, because they are caused and driven by so many other factors. So, and it's a really good point though, because we've been trying to work out how do we develop a sort of meaningful monitoring framework to try and help us understand if we're getting to where we are trying to get to, because the headline BMI figures, and there are lots of reasons why you might not want to use that as your headline figure, actually they are driven by so many things that it's impossible to say which of the things that we're doing works and how that compares to what the national action, what impact that's having. So we have to do this in a bit of a pragmatic way, but we can definitely, there is a lot of evidence that, have a look at the JSNA, tell us if there's more that you need over and above what's in there, and we can provide a briefing. That would be helpful.
Okay, super. So let's just make sure we've really crystallised that. So you're going to bring back the delivery plan to a future meeting. That's great. We will look forward to that. Alongside that, Marianne, we will take a look at the JSNA and answer the question as to whether there is anything, whether there are any additional questions beyond that we've got. If there are, we will explore what possibilities there are for briefings to understand the picture, as much as anyone can understand it, of healthy weight on a range of other issues, but without commissioning fresh work and a whole load of industry around the city, which we understand is not possible. Okay, fabulous, thank you. Okay, so I think that you have got our approval for the direction of travel. You've got some comments on the city specific things, and we will come back to you around specific contributions that the board might make to pulling all of this off. Thank you both so much.
Brilliant. Thanks so much, everybody.
Moving on to agenda item 8, suicide prevention in the City of London annual update. This item is for information on pages 215 to 254.
Lovely, thank you so much, Rhys. So I think we're going to hear inputs both from Claire at a City and Hackney level, and then from Anastasia looking specifically at the city. So this item is for information to make sure that we understand what is happening. Claire, can I come to you first, please?
Yes, thank you, Chair. I would just like to remind members that communication around suicide is extremely sensitive. And as per the Samaritan's guideline, we do not discuss locations or methods. So if the members could please be mindful when they ask their questions, as we are in a public forum. Thank you very much. I shall now launch into my annual update. I apologize, my screen is taking a while to show up. So I just wanted to highlight the data for 2024 and 2025. So in 2024, we had 104 attempts. In 2025, as of July, 65. In terms of contemplation, we had 97 in 2024 and 41 in 2025. And then completion numbers last year were high. We had 10, and this year we're under 10 for now. So in terms of the age range, most individuals are aged between 18 to 29 years of age, and people completing suicide were aged between 17 and 57 in 2024, although most were in their 20s, 40%. And then gender, females represent 53% of attempts, whilst males represent 47%. But in terms of completion, obviously it follows the national trend, and it is more males than female. And then the majority of individuals traveled into the city from their home address outside of the city to use the urban infrastructure. And then I just wanted to do a quick update on the Bridgewatch Volunteer Patrol. They're working well. The National Institute of Healthcare and Research evaluation of the service should be available next month. And we had a big day on World Suicide Prevention Day where the volunteers patrolled all day. More data is available in the report. I also wanted to say the business healthy suicide prevention training for employers is still going strong after 8 years of it being in place. We are very lucky that we can offer city businesses training with the Samaritans, and then if there's been an incident as well in those businesses, we can support them and their staff in that way. Not every other local authority is able to do this, so that's another thing. And then on the action plan, overall we have 69 actions, and 5 new actions have been added since this board last saw the action plan. One of them is about City Bridge Foundation, very generous 10 million grant funding for suicide prevention charitable projects. Another one is about the Tower Bridge security teams patrol. And then one is on the creation of a river incident database with riparian partners. This is particularly exciting because up until now, the city and the square mile are really the only area where incidents are recorded so well. So if we could do it all along the Thames, it would be extremely valuable. And then I think if that's all right with you, Chair, I will hand over to my lovely colleague Anastasia, who is in charge of the what we call the enhanced action plan. So these are actions that came out of the October 2023 City Hope Conference. And I will just let Anastasia walk you through them because it's her work.
Thank you, Claire. Anastasia, the floor is yours.
Thank you, Chair. So my name's Anastasia. I'm the Suicide Prevention and Projects Officer for the City of London Corporation specifically. As Claire mentioned, it's a new post for the corporation that was created as part of the Enhanced Suicide Prevention Action Plan. And I've been in post for 5 months, but it has been a busy 5 months. So the remit of the role is very broad, but I will focus these updates on the 3 kind of key work streams that are part of the Enhanced Action Plan. And I will be brief, but if there are any questions or you'd like me to go into any more detail, please do let me know. So the first strand of the Enhanced Suicide Prevention Action Plan is to do with a suicide prevention charter, which is to be an internal charter rolled out for the City of London Corporation and related bodies. So we're talking about City Bridge Foundation, City of London Police. So those parties that are part of the corporation that are, integral to be able to deliver suicide prevention for the square mile. It is an internal facing charter, so the intention is that it is the thread that enables our colleagues to feel empowered to be engaged with suicide prevention initiatives that already exist, but also for us to be able to better support them in identifying where there are gaps in suicide prevention across the city already. There is a draft of the Suicide Prevention Charter, which is going through officer governance. That's being led by SRO Gavin Steadman, and it has been designed. And we also currently are refining a draft proposal for the way that we launch and then embed the charter across the organisation. So this is the pre-launch stages and also 12 months post-launch, because our intention is that this is not something that we sign and then never see again, but that it is very much embedded and sustained into the operations of the organisation. While we wait for those approvals to take place and for kind of the plans for launch to be refined and take form, we have been working on making internal connections, and we've had 30 internal touch points where we've been looking at identifying gaps where City of London Corporation colleagues in particular may either come across things in their own work which makes them vulnerable to suicide, or where they may interact with members of the public that are vulnerable, and making sure that those colleagues of ours are equipped and supported to deal with those situations. So examples may include work that we've done with the security team at the Old Bailey, where of course they are dealing with vulnerable members of the public, but they themselves are hearing distressing things day in, day out, and making sure that the right support is in place for them. And we continue to develop and build on the things that already exist in the city in this space.
Also kind of a key part of that work has been collaborating with HR colleagues here within the corporation, involving a full audit of all 70 of our HR policies, looking at where we can tighten the inclusion of mental health and suicide prevention so that our policies and practices are aligned with what we are saying we would like to be held accountable for with regards to suicide prevention. On to the next strand of the enhanced action plan. So there was an intention to set up a business network. So this was a way to engage businesses across the square mile in suicide prevention efforts, both that are spearheaded by the corporation itself and the support that we provide, but also all of the things and the work that are happening within those businesses already. Coincidentally, around the time that this post was created, the City Belonging team launched a mental health network, and also what we identified, of course, is that there's lots of mental health and suicide prevention engagement already happening with businesses. So organisations like the Lord Mayor's Appeal, who have a This Is Me programme, which is their workplace mental health destigmatisation campaign, and also organisations like Business Healthy, which, as Claire mentioned, is our vehicle for providing suicide awareness training to businesses. So at the moment, we are working on a plan which will enable us to pull together all of those parties, not to duplicate work and to make sure that we're aligned in our purposes of mental health and suicide prevention, but also making sure that it's clear for members of the public or businesses or residents or visitors who might engage with the corporation where the information is coming from and where we can provide kind of a really streamlined and clear route to support and awareness and education. While we work on what the format of that will look like, we have not been resting on our laurels. We've made around 80 contact points with external stakeholders. So this is largely businesses, but also charities and organisations in the third sector specialising in suicide prevention or business collaboration and engagement, to really kind of lay the groundwork to make sure that they understand what our remit is and providing the support and guidance and education around suicide prevention, and to be able to really highlight the fantastic support vehicles which are available already across the City of London, and also to start to understand what kind of gaps there are. So where can we fill, you know, those opportunities to strengthen the offering in the future in a way where we're not assuming, but we're asking the questions around what is it that they're lacking and what is it that we can provide. One of the things I'd like to highlight is I think typically when people think about businesses within the City of London, and this may not be the case for those kind of in the room and online today, but we make the association with large corporate organisations. However, we know that SMEs and small businesses, as much as any other organisation, are, you know, crucial to the square mile. So we have been working collaboratively with the Small Business and Research Enterprise Centre, which the corporation runs. They have thousands of SMEs as their members. We are providing education to their staff around what support is available and how they can engage on the topic, and looking at opportunities to engage with those businesses, recognising the financial well-being strain of throwing everything into starting a business and making sure that we're offering support at that point, which is very exciting, but can also be very daunting. And then the final thing that I would like to update on is work around the built environment. So as many will be aware, there is a publicly accessible planning advice note, which was authored by Claire and our colleague in the commercial environmental health team, Toby Thorpe, which provides good practice guidelines on how tall structures can be made safe. We are working on both looking at how we can work with building accreditors to retrofit buildings which already exist in the city in line with those guidelines, which we know are evidence-based good practice. But we also have been doing a lot of work to implement that far and wide within the city, but also beyond with the national remit to encourage more to be engaging with it at the design and planning stage. So that involves the planning advice note being shared with a network of councils across the UK through the Centre for Mental Health, who are a think tank mental health charity, to ensure that other councils know of its existence and are able to use it within their remits. And also we have been engaging with around 24 providers of
architecture qualifications, to encourage the providers of those qualifications to include this as a resource to their young students, so that architects of the future know of its existence and understand its importance. We've had really positive interactions with regulatory bodies in the architecture space as well, again to encourage at a higher level encouragement of uptake of the planning advice note, particularly for institutions which have not been as forthcoming as I would have liked them to be. So looking at different options to apply that. And we continue to build relationships with the City Bridge Foundation, looking to find ways to support the work that they're doing. An example being we have been working with their catering and staffing providers for events to make sure that awareness and education and support is in the right places, again, for those colleagues who may be vulnerable to those situations. There's a lot that's happened in the last 5 months, but lots to look forward to, and we'll see some of these work streams taking more tangible fruition in the near future, I think. Thank you, Chair.
Thank you so much, Anastasia and Claire. Huge amount of work clearly going on in all of those spaces. So I think our job here is not in any way to take decisions, but this is for information. So I think our job is to ask questions for clarification to make sure that we all understand the work that's happening. Dawn, Marianne, Stephanie.
Thank you for that update. And as ever, thank you for the hard work that you carry out, all of the officers across the City of London and stakeholders. Thank you. Obviously, you know, this is something I'm very passionate about. I came across an event which is being held next month about menopause, mental health and suicide awareness. I think you might be able to twist somebody's arms to get the fees to attend, because I think it'd be very beneficial. It highlights that women between 45 and 54, the typical age of premenopause and menopause, have the highest suicide rates across the UK, and it's hidden. And seeing the increase in females presenting, I know that they are people who don't live in the city, but I just wondered if there was some link and whether or not it'd be worthwhile you and Claire attending that session to see what other advice and help that you can actually get to embed into this, in particular in our internal facing document, because I know we have a policy on menopause there, and it might be something that we're not including within that that policy, which might be able to help the corporation itself. In terms of the internal facing document, I would ask that we extend that to our city contractors, in particular our highways teams who are out working at night, and they frequently come across people presenting, and they find it incredibly frightening. Good training will assist them and also help them, as you say, its the effects that it has on the individual itself. And I know we do a lot of work with Tower Bridge staff, so thank you for that. Retrofitting, I've got down here as perhaps should be a work stream. Yes, retrofitting our high risk locations, and the planning advice guidance is brilliant, but it is not being implemented fully. I'm still having planning meetings with buildings coming forward with barrier rails which are too low, high terraces, and the issue seems to be that you're not engaged at the pre-application stage, and by the time the scheme's worked up and it comes to committee, it's deemed too expensive to amend. So we really must get that embedded if we're really going to make a change. Otherwise we're going to spend a lot of time and money retrofitting. And just on Bridgewatch, we had International Suicide Prevention Day last Wednesday, and we held 12 hours of shifts from 5 AM in the morning till 5 PM in the afternoon. So huge thanks for all the volunteers. Many struggled because the tubes were on strike and they had to find alternative ways. But can I just say, in terms of Bridgewatch on the volunteers, incredible group of people coming from all over the country. Our supporters and stakeholders such as the PLA, the RNLI, Transport for London and the Business Improvement Districts and the liveries are doing so much to help. I just wish the corporation itself would step up to the plate a bit more and provide us with more support and funding. We haven't had anything since the initial 2023, so perhaps that's something you can take away with City Bridge Foundation and the corporation. They are their bridges, and we're volunteering to ensure that people are safe. And I will say that it's very well received, Bridge Watch, by people, members of the public, who take the idea back home, and they want to replicate that. So it's been a great success for the City of London, but that's down to the volunteers and down to Claire and people like Gavin. So thank you.
Thank you so much, Marianne. A tour de force of questions in there. 4, I think we've got one around the focus on women and menopause. Where's that reflected? Internal facing, does that include city contractors and highways specifically? 3rd, around planning and making sure that the planning guidance is integrated at the earliest possible stage, so we're not in expensive retrofitting. And lastly, with enormous thanks to Bridge Watch, and where does the city sit in that? So Gavin, over to you.
Thank you very much, Chair. So I'll pick up the first one in there. I think certainly something we'd be interested in attending. We can arrange that. If you can send the details over, certainly we can ensure that Claire and or Anastasia can attend, and then we can use whatever information out of that to reflect in our review of our own internal policies. And so the engagement that we've had with HR colleagues on this has been really good, and they're going through reviewing now. So there's always the opportunity to continue to update and reflect any changes, new information. Moving over to the charter, there was a decision made for that charter to be inward looking rather than external, and that's because there's lots of different charters out there, and we felt that it would be unfair to put our backing behind one when there's lots of companies that are already in this space already signed up to a charter. So I think perhaps what we could do in this case is, if we have a contractor that is already signed up and it's an appropriate charter, they're already conscious and mindful of these things. If they are without a charter, then we can provide them with appropriate advice about where they could look and support them through that process. And we have 2 very excellent individuals that can point them in the right direction and give advice. With regard to retrofitting and the planning process, yes, that was something that came to my attention quite early on. I have had a number of meetings with the Director of Planning, Gwyn Richards. There's been training that's been undertaken by Claire and Anastasia with planning officers, and we are monitoring that position to make sure that we are providing advice to planning officers as early as possible in that process, and we'll address anything that comes up. So it's a continuous monitoring piece, I think, on that one. With regard to Bridge Watch, and I guess just as a bit of a wider piece of information, there is a cross-committee group that sits that's made up of chairs and deputies or representatives from a wide variety of different committees across the corporation. That's chaired by Caroline Haynes. They will pick up some of the wider points around the funding bit, which needs to be taken through the right channels, and there'll be further discussions with City Bridge Foundation, but actually wider partners as well as appropriate across the Square Mile and our own corporation and the institutes that are associated with it. So there's lots of work going on, which I'm pleased to see, and between particularly Anastasia and Claire, that have driven a lot of this forward in recent times. Thank you very much, Chairman.
Super. Thank you so much. Dawn.
Thanks for the update. Just thinking about another group of people that perhaps we could target is perhaps the pubs and the bars along the river, but the actual staff themselves, because they often come out late of a night walking home, whether that's, I don't know, to London Bridge or wherever.
I've done that already.
Oh, you've done it already. Thank you. Thank you.
Yeah,
the other thing I just want to just ask about is the fact that the females, there's more highlight on the percentage of females having attempted suicide, and is that linked to the 20-year-olds as such, and what do we think is causing that? Thank you.
Thanks, Dawn. Claire, do you want to come in on that?
That's a big question. So we have seen a shift nationally in the numbers of female deaths by suicide. Just a 1%, so it used to be 75% men, 25% female, and it's just starting to switch. So we're at 26% female deaths now. And then in terms of attempts, we are since COVID, we are really seeing an increase in young female attempting and in self-harm as well. I'll be perfectly honest with this group. I can't tell you what the reasons
I'm so
are
sorry.
because they're multifaceted.
Claire, I'm so sorry.
Can you
We're
hear me
really
again?
struggling to hear you. I wonder if maybe turn off your video, see if that helps with the audio stream.
Hello, I apologize. Is this better?
Not quite sure. Try again.
How about I answer the question offline in an email? Is that okay?
I think that would be
My
excellent. Thank you so
apologies.
much, Claire. I don't know, Anastasia, Gavin, whether you want to come in on either of those questions. Pubs and increasing representation of women in the data.
Yeah, so as Claire mentioned, that is the pubs and kind of hospitality piece is something that she has done work on already, and Business Healthy is an important public health vehicle for delivering training and support around this for any businesses. And when we talk about the business engagement that we do, it certainly isn't sort of, as I was trying to illustrate around kind of the SME point, we don't want to just do kind of, you know, the finance and the law. They are very important, but it's about the square mile as a whole and all of the different types of businesses that contribute to that. So certainly as we continue to shape the what the business network looks like, we can also have a look at, you know, how we can build on the fantastic work that colleagues like Claire have already done in this space.
Thank you. And Claire, that's great. If you could follow up on the on Dawn's other question by email, that would be much appreciated. Lovely. All right, well, thank you so much. I think you're hearing high commitment to this work from the board, high interest, and we look forward to your next update. When does that happen? An annual item, it is.
Yes,
Super.
but we also do quarterly update to which you should be invited as a chair.
Wonderful. All right, thank you so much. Okay, Reece.
Thank you, Chair. Moving on to agenda item 9, air quality annual status report from 2024. This item is marked for information and is to be taken as read unless members have any questions.
My understanding is we haven't had questions in advance. Are there any questions in person? I don't know. Super. Okay, thank you.
Moving on to agenda item 10, questions on matters relating to the work of the board. No questions were received in advance of this meeting. Do members have any questions? Yep. Moving on to agenda item 11, any other business that the chair considers urgent? Chair.
Only just to flag that we've got this joint meeting of the City and Hackney Health and Wellbeing Boards on October the 23rd, and I think it's my job to encourage everyone to prioritise that and attend. So thank you.
Thank you, Chair. Moving on to agenda item 12, exclusion of the public. This item is for decision.
Thank you.
Okay, we shall now exclude the public, and I will ask my colleague to end the live stream. Bear with me.